Welcome to the Best of Beaver County, presented by St. Barnabas, a weekly segment dedicated to putting the focus on the amazing things and the amazing people behind them in Beaver County. The Best of Beaver County is sponsored by and content is provided by St. Barnabas. The show airs every Thursday from 11 to 11:30 on WBBP, WMBA, 99.3 FM, and Facebook Live. Now, with no further ado, let's welcome host Mike Romigh to introduce today's program.
Okay, in 3, 2, 1. Welcome back to the Best of Beaver County radio show. I'm Mike Romigh, and our guest is Jeff Bost. Jeff is a neurosurgical certified physician assistant. We're talking about Alzheimer's disease, drugs. Welcome to the Best of Beaver County radio show on the St. Barnabas Radio Network. Since 1900 and counting, St. Barnabas has been caring for people in southwestern Pennsylvania. Today in Allegheny, Beaver, and Butler counties, we offer a full continuum of care for our patients, residents, and retirement community. The St. Barnabas Health System has developed into a visionary leader in the healthcare industry through compassionate and quality care by offering an array of unparalleled healthcare services, from skilled nursing to extensive memory care activities and programs. Additionally, the medical center has specialty doctor and dentistry teams where patients can receive a full range of services under one roof. Comprehensive rehabilitation, hospice care, palliative care, home health, and home care are also some of the other solutions dedicated to enhance the daily lives of our St. Barnabas family. Building upon its heritage, St. Barnabas continues to reach those in need and live out its mission through individual and institutional services that promote the health, education, and social needs of others. Men and women are invited to join in the work of continued Christian caring, healing, and teaching, and along with St. Barnabas, bear witness to its founder's reminder, God is able. It seems almost daily we hear about a new vitamin or drug being introduced to provide some relief for when we're not feeling well, or we want to lose weight, or even manage other medical conditions. And just last month, we heard about the new drug that, once approved, could end Alzheimer's. Our guest will provide an update, talk about efficacy, and comment on when this drug may be available to those suffering from this debilitating disease. Jeff Bost joins us now. Jeff is a neurosurgical certified physician assistant. Welcome back to the show, Jeff.
Mike, it's great to be here as always.
Thank you for agreeing to come on once again. And I know that you and Dr. Maroon work in the capacity of vitamins and minerals and these type of things. And also memory care is a very important aspect of what you do. So when you hear about these different medicines, prescriptions coming out, what kind of conversations go on between you and Dr. Maroon?
Well, thanks, Mike. You know, we are very interested in brain health. That was one of the reasons about 6 years ago we talked to the leader of St. Barnabas Health System, Mr. William Day, and decided to develop a brain care program at St. Barnabas Health System. And that's what we've really tried to spearhead over the last several years, to give those that are getting older or even younger an empowerment to know what to do to try to prevent Alzheimer's or decline that can go associated when we get older. So that's really been our focus for a number of years now. And with the new drugs, as you're mentioning, it's quite an exciting time. But I'd like to caution you, in your previous statement, it's unlikely that this drug will end Alzheimer's or any similar drug to it. One of the things I think we're petrified of the word Alzheimer's, as we should be. But most people don't really understand it. And I think the best way, Mike, before we go too far, is to really help people understand Alzheimer's disease is a disease of aging. So it's very similar to what something a lot of people know about, that is heart disease. What happens with heart disease? As we get older, more and more plaque forms in our blood vessels, and that's due to diet or lack of exercise and all the same things that we've talked about frequently together. And it's a lifestyle condition. Now, there are genetics that are associated with vascular disease as that plaque builds more and more. But there's probably about 90+% of people that if they were to have an autopsy, no matter how old they were, greater than 70 years of age, they're all going to have some amount of plaque in their blood vessels. And yet they may never have had a heart problem or a heart attack. So Alzheimer's is sort of similar to that. As we get older, the plaque, if you will, and we call that beta amyloid, which is basically a protein waste product made by brain cells, can build up into the brain. And in fact, people that are autopsied that have no clinical symptoms of Alzheimer's disease, in fact, have beta amyloid plaques, which is a sign of Alzheimer's disease, in their brain. So you can have the plaques in your brain but not necessarily have the disease, which is a clinical diagnosis of dementia, not thinking well or losing your memory. So it's a very complex subject, but what it tells us is there's a tipping point. The amount of plaque that we see in blood vessels will eventually cause a heart attack in some people if they pass the tipping point. And the same thing is true with Alzheimer's disease. If the plaque gets too much and the brain gets overwhelmed and slows down its function, then they'll have symptoms of Alzheimer's disease. So this is really where a lot of these new drugs are focusing, is to try to eliminate or reduce the amount of plaque that is building up in someone's brain that may be causing dementia later on in their life.
It's interesting because you speak of plaque, and for most of us, when we hear about plaque, we've only heard about it through our dentist. Plaque builds up between our teeth, things like that. So we don't understand unless we're watching a documentary somewhere in which they highlight different areas of the brain to show us how this is firing and that's not firing. How does plaque accumulate in our brains?
Well, plaque in our brain is a waste product. So our brain cells, they use energy. In fact, the brain gets about 20 or more percent of the blood supply in our body, supplying both oxygen and nutrients. So the brain is a very metabolically active organ. As a matter of fact, the most metabolically active organ in our body. So it's a high production rate going on in our brain. That means it has to have a lot of good clearance of the waste products. And ironically, when we sleep is when the brain typically is able to clear most of those waste products. But as the waste can build up, and primarily it's called beta amyloid, which is a protein, can build up, it can form plaques. And these plaques eventually cause an inflammatory process. And that inflammatory process is the body's own activation of molecules to try to clear that plaque. But after a while, it can't, and that's when it starts disrupting the brain cell function, and that's when you start having symptoms associated with Alzheimer's disease. Mm-hmm. So these new drugs that we're talking about, they're called monoclonal antibodies, which is a big word, but basically it means they've developed antibodies to fight the plaque. So instead of fighting bacteria, for example, which we hear a lot about, take your antibiotics and get rid of the bacteria, this antibiotic or a monoclonal antibody affects the plaque that's in our brain and starts to break it down. So it's basically a race against time that these drugs are trying to remove the plaque as it's continuing to build. But they are seeing some benefits, and we can talk about that.
Yeah, definitely, because as you mentioned earlier, that none of these drugs are going to end Alzheimer's. Alzheimer's is a progressive disease, so it's going to continue to build. Can we slow down the process?
Well, that's something that I love to talk about, and we've talked about before, and we also have been talking quite a bit on our Living Well radio show on Saturdays, is that the best way right now that we know to prevent and actually even reduce the symptoms of Alzheimer's disease is through our life choices, what we do and what we decide to do, whether we're able to have a healthy diet, whether we're able to exercise. I already talked about sleep, how important that is for us to have sleep so we can clear some of the toxins in our brain. Increasing plant-based foods versus meats, not to necessarily give it up, but to change our diet to have a more healthier diet. Consuming more antioxidants, berries, and fruits, and so on. So there are so many things that we can do. Matter of fact, exercise is probably the best thing we can do, because exercise brings more blood and oxygen to the brain. And again, as I said earlier, the metabolic rate of the brain is so rapid that it really can almost consume all the oxygen we could generate. So when we aren't active, we aren't consuming a lot of oxygen, but when we're active, like exercising, we're able to get more oxygen into our blood and help the brain work better, and in fact can help reduce the incidence of Alzheimer's disease. So there's so many things that we could do, and in fact, I think a lot of people now are doing those things because they realize that a drug is really not going to be curative in most cases.
Mm-hmm. And you have talked before on this program, you just mentioned berries, consuming blueberries, more plant-based foods, omega-3, you've talked about that before, fish oil, you've talked about those sort of things. What are some of the other antioxidant foods that we can consume?
Well, those are some of the best. Fruits and the fruit, it's really amazing. We cut off the skin of fruits, whereas the skin has the most benefits of fruits and vegetables because it's the outside of the plant. So the outside has to provide all the protection to what's going on in the inside. So those antioxidants in nature on plants are fighting funguses and bacteria and insects, and it's the defense mechanisms of the plant in the skin, like blueberries or strawberries and other fruits, grapes. When we consume them, they give us those benefits. So never peel your vegetables or fruits in the sense that that's where you have the most nutrients.
Okay. And you have also, when these new drugs come out and they're heralded as the next best thing and the best possibility, but this is something you and Dr. Maroon have commented on previously, not necessarily these drugs, but there were other drugs that have been introduced. What's the status on those things?
Well, there's many things over the years that people have used to try to reduce Alzheimer's disease. Anti-inflammatories, for example. I talked earlier how the plaque can cause an inflammatory reaction in the brain, which just basically makes things worse. And in fact, there's large population studies that show people that chronically take anti-inflammatories, perhaps for joint problems, or people that take chronically aspirin, perhaps for heart disease, may have a lower rate of dementia or Alzheimer's disease. So these doesn't necessarily mean it affects the individual, but these are large population studies that they've looked at that's shown that. So there are things that have been tried and have worked to some degree, but right now the newest drug that was approved this year, Leqembi is the name of it. Was approved what we call in a fast-track method, which means that it just had to show some benefit, not a curative benefit. And those rules about accelerated approval or fast-tracking were put together back when HIV was rampant, and we really didn't have a cure for that. And so a lot of drugs were just sort of slapped against the wall and see if they worked. And the rules are, though, they had to change or provide some benefit, whether that was a lab benefit. And in this case, Leqembi showed that the memory decline slowed by about 20 to 30% in most people that took this medication. So if someone has Alzheimer's disease, and these were early Alzheimer's patients, meaning having mild or early symptoms, they may still be active and driving and maybe even working, but they were having more and more difficulty with their memory, perhaps. 20% perhaps improvement may make a difference. However, unfortunately, the lead research team said in most people they didn't necessarily notice a difference. But again, they only study for a fairly short period of time when they get this data, and perhaps over a longer term it might make a difference.
We're talking with Jeff Bost. We're talking about Alzheimer's and some of the new announcements that have come out about it. And it gives a lot of people hope when they hear these things. And we'll continue our conversation and find out more about ways to slow the disease, slow dementia, slow Alzheimer's, as we continue our conversation with Jeff Bost on the Best of Beaver County radio show on the St. Barnabas Radio Network. Of the many things that make St. Barnabas Health System apart from the ordinary is an appreciation for their employees, an act that does not go unnoticed. Let's learn more about what this means from one of their employees.
Hi, my name's Susan Elleteri. I'm a registered nurse at St. Barnabas. Our team is responsible for the excellent care of our residents. Tending to their specific needs is very important. We pursue compassionate care, hard work, and kindness, and it is an extremely rewarding career, and I'm very grateful to have nursing as a career. It's extremely rewarding. We can acknowledge the goodness in our life, and I do believe that.
Find out about the exceptional career opportunities St. Barnabas has to offer by visiting stbarnabashealthsystem.com/careers for more information, or by calling 724-444-JOBS. That's 724-444-5627. Find out why St. Barnabas is apart from the ordinary. Okay, in 3, 2. Welcome back to the Best of Beaver County radio show. I'm Mike Romigh, and our guest is Jeff Bost. Jeff is a neurosurgical certified physician assistant. We're talking about Alzheimer's disease, drugs, people affected by Alzheimer's. And when these announcements come out, it gives a lot of hope to people thinking that, is this going to be a cure? Many times it's false hope. And as we were talking in the earlier part of the program, Jeff, in terms of maybe slowing down the process, but if somebody's in the late stages of Alzheimer's, these sort of things may not necessarily work on them at all. This is more or less in the beginning stages. Do I have that right?
Well, this drug was reviewed and studied for people in very early Alzheimer's, meaning they had mild symptoms. So whether it helps someone that's older and has more plaque and more symptoms, it's hard to say. However, 2 years ago, you may recall another drug that was also a monoclonal antibody was approved by the FDA very controversially. Its name was Juhelm. And that drug was used on people that had dementia to a greater degree than this current drug, Leqembi. And so this drug that was approved 2 years ago, as I said, targeted those that were more severely affected, and it did not show the results as clearly as the drug now being used in people that did not have such severe dementia. Now, what that means, I don't know. We could have conjecture and say perhaps at the very first signs of Alzheimer's to start on a drug like this, and then over the years it might slow the curve of memory loss and sort of prolong the ability to be with a good memory. That could be possible. But, Mike, when we say, just to get back what you said about false hope, I think there's several things that we can take positive out of this. Number one, that these types of drugs, the monoclonal antibodies, are having some benefit. And so that, researchers build from the research they know that has previously occurred. So that building block is another step. And I think it is an exciting step because Alzheimer's disease has really been a black box to pharmaceutical companies for a long time. And they've been spending literally trillions of dollars into research to make these things work. And so these little lights that are coming through with these type drugs are maybe giving some hope that the research may be paying off and something may occur. However, as of today, lifestyle modifications, the things we talked about before the break, are really the best way, thinking about these disease maybe 20, 30 years before they are occurring, to really change your lifestyle to prevent them.
Yes. I'm glad you said the name of that other medication, because I was looking at it and I'm thinking, I'm not a doctor and I can't prescribe and I don't even play one on the radio, but I would have truly butchered that word.
Well, I cheat. I look on the internet and see how the pronunciation goes.
Yeah, and we talk about these drugs, and you had mentioned Leqembi?
Well, it's actually been shortened to Juhelm.
Juhelm, okay. But when these come out and the scientists in the laboratories are working on them, then they send them off to the FDA, and the FDA does something they call accelerated approval. What does that exactly mean?
Well, that was what I was referring to a little bit earlier, in the sense that it was developed relative to the HIV crisis, and it doesn't look at the endpoint, which many other drugs. So, for example, antibiotic to take care of a staph infection, which is a common skin infection, would have to show that it actually did that. Whereas this approval system just shows that maybe they were able to knock out maybe half of the bacteria, but it was still there, and eventually the person would still have an infection and need to have their toe amputated or something. So what it shows is some measure of improvement, not necessarily curative. And this fast tracking, it was new because HIV was killing so many people that, any benefit that showed longer life, for example, and there are certain chemotherapy drugs that are approved this way as well. So this is a different classification or review process. But Juhelm, when it was approved 2 years ago, was very controversial in the sense that the panel that was reviewing it actually did not initially approve it, and it was overridden by the director at that time. And it is not widely used in the sense that it was approved for just further study, whereas this drug, the new drug, Leqembi, is now approved for people, and probably later this year it will be available. Now, just the specifics of the drug, right now it is an infusion, which means you have to have an IV injection of it twice a month, and this will continue, obviously, for the rest of your life. And it's not inexpensive. It's probably going to be around $26,000 a year. And there certainly are known side effects associated with this drug, including brain swelling, and some changes of the brain that can occur with it. So it's not the end all, but as I said earlier, perhaps it's a stepping stone for more benefits and more beneficial drugs.
As we learned during the pandemic and vaccines associated with it, that sometimes the FDA and the CDC, agencies of the government, can be politicized. What is the Oversight Committee, and how do they operate?
Well, these are independent professionals, mostly physicians and researchers, who have the knowledge in the area, and they give an opinion outside of necessarily the FDA, those who are employed by the FDA, and certainly outside of those that are employed by the pharmaceutical company. So they're sort of an independent set of experts to review things, and it's a common practice. It gives an outside look. A lot of these folks are people that work day to day with types of patients, and for example, they would be a lot of neurologists and people that work with people with Alzheimer's disease, and they would give a honest opinion relative to whether this would help their patients.
Okay. And in terms of patients or caregivers, will they get an opportunity? $26,000 is a pretty hefty expense, but for the health of our loved ones, we're willing to pay just about anything. But will those caregivers will they be able to choose one over the other?
Well, right now there's only this one approved. The newest one approved this year was Leqembi for general use, and the qualifications of that are I don't think completely set up in the sense what the qualifications an insurance company will pay the other amount that they'll cost, because the $26,000 I believe is the cost to the patient. So these will be certain criteria. It worked in mild to moderate people with Alzheimer's disease, so that might be a criteria. There might be certain MRI criteria or PET scan criteria for the insurance companies to approve it. I just don't know, and those details have not been made available.
Many of the people listening and watching this program have taken Tylenol or Advil or Motrin, and in most cases experienced the reduction of the discomfort of minor aches and pains pretty quickly. Is there any information or an expectation for how effective these new medications will be? I mean, are we on an insulin, penicillin, polio vaccine discovery path?
I don't know the future, but I can tell you right now at this stage, no. As a matter of fact, as I said earlier, most researchers who participated in this will say that the patients who were given this drug did not notice any difference. Now, oftentimes with Alzheimer's disease and dementia, you don't have an insight into your own assessment. You can't really tell from yourself, but these were measures that they did as far as memory and thinking, tests that they did, which showed the improvement. But the researcher did not specifically think that the individuals given this drug would notice any difference. But again, we're talking about a time frame that is not a lifetime, meaning if you took the drug for 6 months and then improved your memory score or your memory score stabilized, what's going to happen in 6 years? I mean, that might be a profound difference over 6 years. We just don't know.
Jeff Bost is our guest. Jeff, all of these initiatives are based on a determination to increase the quality of life, especially for those who are struggling with this disease, whether patient, family member, or caregivers. While things look promising, what can the non-medical community do in the meantime?
Well, I think, always, if you do have any symptoms of dementia, make sure you do seek out the medical community, because there are so many other causes besides Alzheimer's disease that may be leading to cognitive decline, from hormone imbalances to diet, conditions of uncontrolled disease can all cause these things. So, you really, if you have any symptoms of dementia, you should see a healthcare professional. But that said, short of Alzheimer's disease, or if you have a worry that you're going to develop the disease, then I think it's all lifestyle. I think we have to start younger than we have been thinking about. It's similar to cardiovascular disease. People in their 40s can have heart attacks, but in general, they're related to a genetic link. Mm-hmm. So if we start in our 30s, 40s, 50s, and 60s by changing our lifestyle, avoiding excess weight, maintaining exercise and sleep, having a good diet, these are things that prepare us for a healthy life and a healthy aging. And pills are great. If I had an infection, I would certainly take an antibiotic and other reasons to take pills. But right now, we don't necessarily have the magic pill to take care of Alzheimer's disease. So I think a lot of it goes back to what we can do ourselves.
Jeff, as far as women are concerned, are they more vulnerable? Because I saw a report not long ago that tried to tie in the idea of menopause and Alzheimer's, and how that may be more prevalent, and that more women than men are stricken by Alzheimer's. Is that true?
Well, Dr. Maroon and I actually have looked at that data, and it's interesting data because these are always population studies. And who's around in the population mostly when you're older? And it's women. Women live longer than men. And so it's statistically skewed, if you will, in the sense that more women may be older, and therefore age is the number one risk factor for Alzheimer's disease. So you may have more women with Alzheimer's disease. I think it's difficult to say that women necessarily have it for a reason. I think it's the fact that women probably live longer and therefore have more likelihood or chance to have Alzheimer's disease.
Very good. Jeff Bost is our guest, and we've had him on numerous times to talk about this very important topic, and we try and get him on as soon as we can whenever these different discoveries come about, and then the tests that are going on, and also the work that has been going on with Dr. Maroon and Jeff Bost about Alzheimer's and dementia. And we'll keep our fingers crossed, because as each comes out and every day passes, it seems more promising that perhaps somewhere down the line, maybe not in our lifetimes, though, they'll be able to do something. There will be some magic bullet out there that will be able to help people who are suffering from this dreaded disease. Jeff, thank you for spending the time with us this morning.
Thank you, Mike. Glad to be here.
Always thank you. And the information and the research that you and Dr. Maroon do and make it available to our audience here on the Best of Beaver County radio show.
Thank you for listening to the Best of Beaver County. St. Barnabas is pleased to have provided content and sponsorship for the program. Tune in this Sunday at 11:30 for an encore presentation of today's program on Beaver County Radio. And next Thursday at 11 for another edition of the Best of Beaver County on WBVP, WMBA, and 99.3 FM.